Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Signs of a diverticulitis flare-up. According to the American Gastroenterological Association, roughly 1 in 5 people who experience diverticulitis will have a diverticulitis flare-up within 5 years. Symptoms usually develop within a few days, causing lower left abdominal pain, fever, diarrhea, and cramping. /r/n/r/n diverticulitis symptoms can mimic those of other conditions, so it's important to recognize not only the signs of diverticular disease but also the risk factors that contribute to attacks. Knowing the signs allows you to take immediate steps to treat symptoms and prevent recurrence. /r/n/r/n illustration by Tara Anand for Verywell Health /r/n/r/n People can get easily confused by terms like diverticulitis, diverticulosis, and diverticular disease. While each is related, they are not the same thing. /r/n/r/n Diverticulosis is a condition in which you develop multiple pouches, called diverticular, in your colon due to weaknesses in the colon wall. These pouches are typically benign and cause no problems. Most develop in the sigmoid colon, the lowest part of the colon adjacent to the rectum. /r/n/r/n Diverticular disease occurs when the diverticula suddenly becomes inflamed, a condition known as diverticulitis. It is not always clear what causes the sudden burst of inflammation, but age plays a major role in that the disease mainly affects adults over 60 and is uncommon in those under 40. /r/n/r/n Among people with diverticulosis, between 4% and 15% will go on to experience diverticulitis. /r/n/r/n All told, around 5% of the US population will experience diverticulitis at some point in their lives. Over 200,000 are hospitalized for treatment each year. /r/n/r/n Whether you have a first bout of diverticulitis or recurrent flare-ups, referred to as chronic diverticulitis, the symptoms feel the same. /r/n/r/n The attack itself, referred to as acute diverticulitis, tends to strike suddenly and cause symptoms like /r/n/r/n Once treated, most people will feel better within a few days, although some cases can take longer. /r/n/r/n In Asia, diverticulosis usually occurs in the ascending colon on the right side of the abdomen, as opposed to North America and Europe where the pain is usually felt on the lower left side where the sigmoid colon is located. Differences in diets are thought to account for the disparity. /r/n/r/n It is not known what causes or triggers a diverticulitis flare-up, but certain factors are known to increase your risk, including /r/n/r/n Certain medicines may also contribute to diverticulitis, particularly the prolonged use of medications including /r/n/r/n Some rare genetic syndromes are characterized by an increased risk of diverticulitis, suggesting a genetic link. These include /r/n/r/n Although genetics and family history of diverticulitis can predispose you to diverticular disease, it does not increase your risk of recurrence, according to a 2023 study published in Diseases of the Colon and Rectum. /r/n/r/n Although coffee has long been demonized as a trigger of diverticulitis along with nuts, grains, corn, and popcorn, there is no evidence that they either cause or trigger the disease. In fact, nuts and grains are today considered protective against the development of diverticulosis and diverticulitis. /r/n/r/n The diagnosis of diverticulitis typically starts with a review of your symptoms and medical history along with a physical exam. The exam will involve palpation, light touching, of your stomach to check for signs of pain, swelling, or tenderness. /r/n/r/n Other tests may be ordered based on the initial findings, including /r/n/r/n Diverticulitis can be hard to distinguish from other diseases based on symptoms alone. Because of this, Additional tests may be ordered to exclude possible causes. This ensures the right treatment is dispensed. /r/n/r/n conditions exploded in the differential diagnosis include /r/n/r/n. A diverticulitis flare-up can often be treated at home, but there are situations where medical care is needed by a specialist known as a gastroenterologist. /r/n/r/n for mild flare-ups, the focus of treatment is placed on diet and pain relief. These typically include the following self-care remedies. /r/n/r/n antibiotics are not recommended for mild diverticulitis as they have not been shown to significantly alter the course of the disease and may contribute to antibiotic resistance if overused or used inappropriately. /r/n/r/n if symptoms are severe, oral antibiotics may be prescribed. These are generally reserved for uncomplicated cases where conservative measures fall short. /r/n/r/n preferred oral options include /r/n/r/n people hospitalized for diverticulitis may need intravenous, 4, antibiotics, in which the drugs are delivered into a vein in your arm. /r/n/r/n intravenous options include /r/n/r/n around 15% of people with diverticulitis develop complications, including an abscess, a pocket of pus due to a bacterial infection, bowel obstruction, and diverticular bleeding caused by ruptured blood vessels. /r/n/r/n in such cases, surgery may be indicated to not only treat the complication but also prevent the rupture of the colon that can lead to peritonitis, inflammation of the abdominal cavity, and a potentially deadly, whole-body inflammatory response known as sepsis. /r/n/r/n diverticulitis surgery typically involves a bowel resection, also known as a colectomy, to remove the diseased portion of the colon. This can be done with traditional open surgery but is more commonly performed with laparoscopic surgery, also known as keyhole surgery. /r/n/r/n after the resection, the cut ends may be surgically reattached or the bowel may need to be redirected through a hole in the abdominal wall using a procedure known as an ileostomy. /r/n/r/n an ileostomy is a life-saving measure that may be permanent or temporary. Once performed, waste is collected in a bag worn outside the body. Most people only need an ileostomy for several months while the large intestine heals. /r/n/r/n it may not be possible to prevent diverticulitis flare-ups given that the underlying cause is not always known. Even so, certain lifestyle adjustments can greatly reduce the risk. /r/n/r/n these include /r/n/r/n diverticular disease is common and doesn't usually cause any symptoms. When diverticula become inflamed, they can cause left-sided abdominal pain, fever, cramping, and diarrhea. This is a diverticulitis flare-up. /r/n/r/n changes in diet, heat pads, and Tylenol may be enough to manage the symptoms. In severe cases, hospitalization, antibiotics, and surgery may be needed. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.